core principles you've identified that sort of guided your work, and then each of them had implications for what you did.
Yeah, my kind of core principles I kind of adopted when coming into the organization were 5 principles. First of all, is making sure that the outcomes of the fund were, were diverse, and range of organizations were able to apply to the fund. So they were kept quite broad so that a number of organizations were attracted to apply for the fund. And the second one was about capturing equality and diversity and inclusion at every stage of the application process and the development of the fund as well. And also taking account of learning and sharing learning at the same time with the funded project. So that was built in right from the beginning to where we are just now as well, still taking account of what's coming back from organizations, but at the same time, government that, through myself, is also sharing learning with the funded projects as well. Alongside that, the fourth one was about capacity building the third sector organizations through way of organizing learning opportunities through networking, identifying what their learning needs are, and providing those opportunities through facilitated workshops, and also recognizing that this was the first fund within dentistry delivered by Scottish Government. So it was a new fund, a new area of work for perhaps third sector organizations who weren't familiar with oral health work itself. So recognizing that and supporting funded organizations with the knowledge and background of that as well, and also taking on board the collective learning emerging from the funded projects and how that can be used to influence change. So these were kind of my key 5 principles, which I tried to put in practice along the way of developing the fund. Principle around keeping the outcomes diverse meant that a lot of organizations were attracted to apply. So we had 75 organizations from a range of backgrounds, from third sector, around from a different geographical areas, were able to apply to the fund. And then in terms of equality, diversity and inclusion and how that were built into every stages. I mean, the first stage I kind of implemented was ensuring that diversity was captured right at the entry point. So organizations were able to apply from a range of organizations. So that was done through promoting the fund within government itself, through the different departments, promoting the fund through Funders Forum, through impact funding partners where I'm actually, seconded from, as well as a range of equality organizations, and even going out to the communities themselves. I went to an Ayrshire open day where we showcased the fund itself and allowed people from those communities to be aware of the fund and give them an opportunity to apply. So just making sure that a range of promotional opportunities were used to make the fund as open and accessible to a range of organizations. And alongside that, making sure the literature itself that we were using to promote the fund was inclusive, and it captured pictures of people from diverse backgrounds. And another aspect of that inclusion and diversity was capturing the diversity and monitoring within the application itself. Excuse me. So these were kind of 3 different aspects of ensuring equality, diversity and inclusion. And then another part of it was, as I shared already, is about learning from the projects and the government sharing themselves. So at the inception events that I organised, there were 2 of them, one in Glasgow and one in Dundee, which allowed the funded organisation an opportunity to hear the strategic intent behind this intervention, and also for organisations to learn about the bigger public health agenda within government and how what they would be doing through the funded projects would be contributing to that health agenda. Alongside that, they also had an opportunity to show about their learning needs. So we did that through facilitated workshops in the room, where people were able to identify what their learning needs might be along the way, what challenges they might come across. And that all that learning and challenges was taken back to then develop a learning program. So capacity building was built in right from the beginning, and resources were set out to do that, to ensure that it's not just about money, but also sustaining those organizations through not only equipping them, giving them the knowledge of the fund itself, but also addressing the needs that they were identifying in helping them to implement their projects with a lasting impact.
Government is doing here is quite brave, because you're effectively saying we don't have all of the answers, and we don't know everything that we need to know. We need that intelligence.
Oh, absolutely. And I think that's key. It's about the community's needs being filtered through those funded projects, for us to then capture that learning coming through those organizations, so that can inform how we move forward and what needs to be implemented going forward in terms of meeting the needs of public health, oral health needs, and how policy is directed going forward, particularly in relation to community work. Obviously, Child Smile programs, which is public health program, is already there, but in terms of working with communities directly, and what they're telling us needs to be directed towards from the communities themselves.
And that's another important link, because again, I've summarised some of the impact and the sustainability that will help the projects with, but the other important link is not just informing oral health policy, but I understand that because of the approach you've taken, other departments within Scottish Government have also shown an interest in the ethos that you've had and the principles that you followed.
Yeah, definitely. I mean, I've had the public health priorities team, and also children and families, alongside service reform division, migration team, a number of different divisions who've shown interest, first of all, to get involved. So, I've tried to use a collaborative approach internally as well. So public health priorities and service reform division were involved at the beginning in the inception event. So that was key to bringing other people on board who are implementing the health agenda within the Scottish Government. And alongside that, those that have wanted to set up programs to learn how I've implemented this funding program and the approach that I've used, so they can take some of that learning for development of their program and use some of the good practices that I've implemented. So yeah, I think it's been key that I've been able to influence not only internally through how I've approached my work and the connections I've managed to build with other divisions and getting them on board and involved in the work that I'm doing, but then also seeing the bigger picture within all of that as well, and how other policies that are being developed or still to be developed can take some of the learning that I've got for their own policy development as well. Passion for equalities and race equality continued in my work within the Scottish Government, and I think I may have mentioned earlier, I captured that within the fund itself as well. Equalities doesn't happen by default, it happens by purpose, so you have to actually make it happen, and I think I've implemented that at every stage of my fund development, and also ensuring that this is captured along the way from learning, but as well as ensuring organisations from all sections of the community have a voice through the fund to advocate the rights and the challenges of communities that they support. So yeah, that's been great in terms of the connections and the developments within government through that work. And also just generally, I think some of the enablers of my work and what I, have kind of the legacy I would probably leave in terms of the work itself is supporting organization, giving them those learning opportunities, the networks that they would have developed through the work, the connections that they've made, the learning that they can take forward, and also just long-term projects that they can develop even without the fund as well. Even if the money's not there, there's still that learning and capacity building that will remain with them and the communities that they work with as well.